Hey everyone, my name is Paige. I'm a team member here with SM NCLEX Reviews. We are continuing to break down big topics and alternate format questions here so you can all practice these strategies on your way to becoming real deal registered nurses, which is right around the corner. Today we are going to be reviewing something you might see in standalone questions, meaning they may not be part of case study style questions. They could appear anywhere on your exam, and that is trends. Let's talk about them. With the new next generation NCLEX, we're seeing a variety of these newer style questions like the trend style question. As far as these questions go, let's review what they are. For this style of question, you will be presented with a client scenario with findings over a period of time. This could include anything like vital signs, lab results, or even nursing notes. You will then be given the question, which could be any NextGen NCLEX style question. So it could be multiple choice, it could be select all that apply, really any question style. These questions entail asking about the client's needs, nursing interventions, or anticipated healthcare provider orders. Your job is to assess the information over time to see if there's a trend and if that trend is in fact significant. The item will be scored based on the question style. So for example, if the question after reviewing the trend is a standard multiple choice style question, you will get the point if you are correct. This could also be a select all that apply question or really any other question style. To review those, make sure you check out our other videos that we have on each different question style. And remember, even if you get it wrong, you can't get negative points on questions. So that's good news. Today we are going to be working through a practice question where you will need to first analyze for any trends that are occurring and then answer a drop-down close style question. As a refresher, with drop-down close questions, there will be one or more drop-downs to complete. Within each drop-down, there will be between 3 and 5 answer choices. Just fill in those blanks and make sure the sentence makes sense as a whole. As far as scoring, you can get partial credit on these, which we love. So let's say there's 3 drop-down boxes. You'll get 1 point for every box you fill in correctly and 0 points for incorrect choices. Your maximum score will be the number of drop-down boxes there are. So in this example we are going to work through today, that would be 3. The lowest possible score is a 0, so even if you miss all the drop-downs in a question, it's not going to deduct from your overall exam score. So again, good news there. Let's move on to our practice question now. So I want you all to complete the following sentence by choosing from the list of options. The registered nurse must immediately initiate blank due to the client's blank, indicating blank. Now there's a lot going on the screen, I know. I want you to go ahead and pause, take a little bit of time to look things over and get your answer down, and then press play when you're ready to walk through this together. So hopefully you had some time to look that over. The correct answer to this question would be the registered nurse must immediately initiate neutropenic precautions due to the client's neutrophil count indicating neutropenia. Let's start with what was the biggest thing you noticed throughout these lab results? There was a significant trend of the white blood cell count, but specifically that neutrophil count, it's also decreasing. Do you remember what a normal white blood cell count is? Now, sources are going to vary a little bit depending on the facility you work in, but it's roughly about 4 to 10,000 white blood cells per microliter. And white blood cells, they play a huge role in immunity, as we know. When they're that low, it's considered leukopenia. But that wasn't any of the options given, so then I noticed that neutrophil count. A normal neutrophil count is between 2,500 and 8,000 neutrophils per microliter. Generally, anything less than 1,500 is considered neutropenic. As a gentle refresher here, those neutrophils specifically, they're a type of white blood cell that play a big role within the immune system and are responsible for protecting the body from infection. Now, let's talk about neutropenia, which is low neutrophils, as we discussed, and leukopenia, or low white blood cells. They often occur together, which we're seeing here with this client. Again, according to most sources, a client has neutropenia when the absolute neutrophil count is less than 1,500 per microliter of blood. Remember, those values might vary a little bit from lab to lab. This decrease can be caused by things like chemotherapy or radiation treatment, certain drugs that suppress the immune system, and even bone marrow disease such as leukemia. Now, let's jog back to our question and review the rest of the incorrect selections. So, what do you know about anemia? Anemia is low levels of what? Oh, that hemoglobin and/or hematocrit. Anemia can be from a variety of causes, and those clients, they might end up needing a blood transfusion or even iron replacement to replace what's been lost. Now, do you remember what thrombocytopenia is? Don't let big words like this fluster you. Remember, we can break down these words. In this case, thrombocytopenia, let's start with thrombo, meaning clotting, cyto, meaning cell, and penia, meaning deficiency. Therefore, we have low levels of platelets. The platelets, they play a major role in clotting for us. And with an infection, typically we'd see an increase in those white blood cell numbers. So like we discussed previously, our client is showing signs of neutropenia here. What are some important things to remember about this? We must initiate neutropenic precautions. Do you remember what exactly that entails? So we would absolutely need to protect them from any source of infection. We would limit exposure to people, especially those who are sick, encourage good hand hygiene, getting plenty of rest, proper oral care, and just good hygiene in general. Also, an important thing to remember is that these clients cannot have fresh fruits and vegetables. They need to be cooked. Also, any meat they consume needs to be cooked to the point of being well done. Also, these clients, they need to avoid fresh flowers. So this is due to germs that may be on them from the soil or the water. Now it's time for a bonus question here. We know we all love bonus questions. The registered nurse is caring for a client who has been diagnosed with thrombocytopenia. What education is important to include with the client's discharge teaching? So we discussed this a bit earlier. Remember, thrombocytopenia, that just means low platelet count. Platelets are important for clotting, so when they are too low, we would need to recommend bleeding precautions. We would educate clients not to use sharp razors, encourage a soft bristle toothbrush, and to avoid foods that are rich in vitamin K, such as leafy green vegetables, spinach, kale, things of that nature. Also, we'd educate them to avoid NSAID use or the use of blood thinners. That would be important also. Okay, so another bonus question here. Let's say the provider has ordered enoxaparin for our client who is 1 day post right hip arthroplasty. At what platelet level would we want to hold this medication and call the provider? Anything less than 100, absolutely. The client's platelets are low, and giving them enoxaparin would make that situation worse. Just because it's ordered doesn't mean it should be given. Remember, you are the last safety check for your client. All right, everybody, that wraps up our review today on trends. Make sure you tune into our next video as we continue breaking down these question styles and big topics. Be sure to go ahead and hit subscribe so you're not going to miss anything. We are rooting for you. You can absolutely do this. Happy studying.